Most doctors wait for patients to come to them. Norman Bethune chased war across 3 continents to find his. The village hut in northern China smelled of blood and kerosene on that winter morning in 1939. Outside, snow fell softly while artillery rumbled somewhere beyond the mountains. Inside, a tall Canadian surgeon bent over a makeshift operating table, his hands moving with practiced precision despite the crude lamplight. The soldier beneath him had taken shrapnel to the abdomen, and without immediate surgery would bleed out within the hour. Bethune's scalpel slipped. A thin line of red opened across his left palm, his own blood mixing with his patient's as he continued the operation without pause. He had no gloves. Supply shortages had left him operating barehanded for weeks. The cut would become infected. The infection would kill him. But in that moment, Norman Bethune did what he always did. He kept working, driven by a conviction that would define his extraordinary life and determine his death. Henry Norman Bethune was born on the 4th of March, 1890, in Gravenhurst, Ontario, into a family where service and restlessness ran equally deep. His father was a Presbyterian minister who moved congregations frequently, instilling in young Norman a sense that home was wherever duty called. His grandfather, also named Norman Bethune, had been a renowned surgeon whose portrait hung in the family parlor, silently challenging the boy to measure up to greatness. Bethune attended the University of Toronto's medical school, where his brilliance was matched only by his impatience with convention. He questioned professors, challenged established procedures, and showed an early talent for innovation that alternately impressed and infuriated his instructors. After graduating in 1916, he joined the Royal Canadian Army Medical Corps, serving as a stretcher-bearer in France during the First World War. The experience of carrying wounded men through mud and gunfire, while they bled out before reaching medical care, planted seeds that would later bloom into revolutionary ideas. In his late 20s, Bethune contracted tuberculosis, the white plague that killed thousands annually. The disease ravaged his lungs, and doctors gave him months to live. Facing death, Bethune demanded an experimental treatment called artificial pneumothorax, where surgeons collapsed the infected lung to give it time to heal. The procedure was controversial, dangerous, and rarely attempted. Bethune insisted. The surgery saved his life but left him with a profound awareness of mortality and an urgency about making his remaining years count. His recovery transformed him. Bethune threw himself into thoracic surgery, becoming one of North America's leading specialists in lung diseases. He worked in Montreal and Detroit, developing new surgical instruments and pioneering techniques that improved outcomes for tuberculosis patients. His hands were steady, his mind innovative, his reputation growing, but success in comfortable hospitals left him profoundly dissatisfied. Bethune saw how poverty determined who lived and who died. Working-class patients arrived at hospitals too late, after diseases had progressed beyond treatment. They couldn't afford the care that saved wealthier patients. The inequity enraged him. Medicine, Bethune believed, should serve human need rather than profit. This conviction pushed him toward radical politics and toward a destiny that would take him far from the safety of North American operating rooms. By the mid-1930s, Bethune had joined the Communist Party, convinced that only systemic change could bring quality health care to the poor. When fascism threatened democracy in Spain, Bethune saw his chance to put theory into practice. He would bring modern medicine to people fighting for their survival. He would prove that sophisticated medical care could operate outside the comfortable confines of wealthy hospitals. He would chase the front lines to find the patients everyone else had abandoned. Madrid, 1936. The Spanish Civil War had transformed the city into a killing ground where fascist and Republican forces fought. Street by street, Bethune arrived in November as a volunteer with the Republican Medical Service, eager to contribute his surgical skills to the anti-fascist cause. What he found shocked him more than the violence itself. The chaos of battlefield medicine horrified Bethune in ways his First World War experience hadn't prepared him for. Wounded soldiers were loaded into trucks and driven hours to distant hospitals over rough roads. They arrived in shock, having lost too much blood during transport. Others never arrived at all, bleeding out in the backs of ambulances while drivers navigated bombed streets. Bethune watched men die from wounds that shouldn't have been fatal, their lives draining away during unnecessary journeys to medical care. The problem was obvious. Blood soldiers bled faster than transportation could deliver them to transfusions. The solution struck Bethune with sudden clarity. If patients couldn't reach blood in time, then blood must reach patients. Instead of waiting for wounded soldiers to arrive at hospitals, medical teams should bring transfusions to the battlefield. The concept was revolutionary and obvious simultaneously, the kind of idea that seems simple only after someone dares to think it. Bethune set to work with characteristic intensity. He purchased a refrigerated truck and converted it into a mobile blood transfusion unit. The truck carried bottles of stored blood kept cold to prevent spoilage, sterilization equipment for preparing transfusion sites, and portable surgical tools for emergency procedures. He recruited Spanish nurses and trained them in transfusion techniques. He established blood collection stations across Madrid, where volunteers donated blood that would be rushed to the front lines. The technical challenges were immense. Blood typing had to be done rapidly and accurately under battlefield conditions. Stored blood needed constant refrigeration and had limited shelf life. Transfusion equipment required sterilization in environments lacking running water. Military doctors, trained in traditional methods, viewed Bethune's mobile unit with skepticism bordering on hostility. They questioned whether battlefield transfusions could be performed safely, whether the benefits justified the risks of bringing medical personnel into combat zones. Bethune proved them wrong with results. His first successful field transfusion saved a soldier who would have died during transport to a distant hospital. Then another. Then dozens. The mobile unit raced through Madrid's streets, sometimes under artillery fire, delivering blood transfusions at aid stations just behind the front lines. Soldiers who would have died from shock survived because Bethune brought medical intervention to them within minutes of injury rather than hours. The statistics became undeniable. Survival rates for serious wounds improved dramatically when transfusions happened immediately rather than after long evacuations. Bethune's innovation was saving hundreds of lives. His mobile blood transfusion service became known as Servicio Canadiense, de transfusión de sangre, and its success attracted attention from military medical services worldwide. The siege of Madrid tested Bethune's mobile transfusion service like nothing before. Fascist forces surrounded the city, bombarding it daily while Republican defenders fought desperately to hold their positions. Bethune operated in this chaos with a stamina that amazed even hardened combat veterans. His typical day began before dawn and ended well after midnight. An endless cycle of racing to aid stations, performing transfusions, returning for more blood, and driving back into danger. The collection and storage of blood became a logistical challenge worthy of military operations. Bethune established donation centers throughout Madrid, where civilians volunteered their blood to save Republican soldiers. He organized the collection process like an assembly line, with separate stations for blood typing, donation, and storage. Refrigeration units ran constantly, powered by generators that had to be kept fueled during supply shortages. Every bottle of blood was labeled with type and collection date, creating an inventory system that maximized freshness while minimizing waste. Bethune's team of Spanish nurses and drivers became experts in mobile battlefield medicine. They learned to set up transfusion equipment in bombed buildings, caves, and open trenches. They mastered the art of finding veins on soldiers in shock, their blood pressure so low that normal techniques failed. They developed protocols for rapid blood typing using minimal equipment, reducing the process from 30 minutes to 5. Under Bethune's demanding leadership, they transformed from medical novices into a sophisticated team capable of performing life-saving procedures under impossible conditions. The drives through Madrid streets, carried constant danger. Bethune navigated roads cratered by artillery shells, sometimes stopping to clear rubble blocking his path. Snipers fired at anything that moved. Buildings collapsed without warning, sending debris across streets minutes after the transfusion truck had passed. Bethune drove with calculated recklessness, weighing the risk to his team against the certainty of death for wounded soldiers waiting for blood. He chose speed over safety, believing that saving lives justified exposing himself and his staff to enemy fire. His work schedule bordered on inhuman. 20-hour shifts were common, sometimes stretching into 30 hours when major battles produced waves of casualties. Bethune would perform transfusions until his hands trembled with exhaustion, then drink strong coffee and continue working. Sleep became something he grabbed in brief intervals between emergencies, often just an hour or two before the next call for blood. His body ran on adrenaline, coffee, and conviction that his mission justified any personal sacrifice. The results validated his methods and his madness. During 7 months operating in Spain, Bethune's mobile transfusion service performed thousands of blood transfusions at frontline aid stations. Medical officers estimated that the service saved between 400 and 500 lives, soldiers who statistically should have died from blood loss during evacuation. The innovation proved that sophisticated medical intervention could happen in combat zones, fundamentally challenging assumptions about battlefield medicine that had persisted since the Napoleonic Wars. Bethune left Spain in May 1937, his mobile transfusion service established and operating successfully under Spanish doctors he had trained. But instead of returning to comfortable surgical practice in North America, he began searching for his next war. The answer came from the other side of the world, where Japanese forces were invading China in a conflict that would eventually merge into the Second World War. The situation in China made Spain look well-equipped by comparison. Mao Zedong's Communist Eighth Route Army fought Japanese invaders from mountain bases in northern China with almost no medical infrastructure. Soldiers died from wounds that would have been easily treatable in modern hospitals. Basic infections killed as readily as bullets. The army desperately needed doctors, but more than that, they needed someone who could build a medical system from nothing in the midst of war. Bethune arrived in China in January 1938, traveling through Vancouver to Hong Kong, then making a dangerous overland journey to reach communist forces in Yan'an. The trip took weeks, crossing territory controlled by Japanese forces and Chinese warlords. When he finally reached 8th Route Army headquarters in Shanxi Province, Bethune was appalled by what he found. The army had virtually no trained medical personnel, no surgical facilities, and no system for treating wounded soldiers beyond basic first aid. His journey to the front lines in Shanxi Province revealed the full scope of the challenge. Bethune traveled on foot and horseback through mountain terrain, visiting field hospitals that consisted of cave systems and abandoned temples. Wounded soldiers lay on wooden boards, their injuries bandaged with rags because proper medical supplies didn't exist. Surgery was performed without anesthesia because there was none available. Infections killed routinely because no one understood sterile technique or had access to antiseptics. The primitive conditions would have discouraged most doctors. Bethune saw opportunity. Here was a population desperately needing medical care, an army willing to learn, and a chance to prove that modern medicine could function in the most resource-poor environments imaginable. If he could build an effective medical system for guerrilla forces operating from mountain caves, he could demonstrate that quality healthcare didn't require wealthy hospitals and expensive equipment. The decision to stay meant accepting hardships that would have been unthinkable in North America. Bethune would live in caves and peasant huts, eat simple food when food was available, operate in conditions that violated every principle of modern surgery. He would face constant danger from Japanese forces hunting communist fighters. He would work without the recognition or resources available to surgeons in Montreal or Detroit. None of this deterred him. Bethune had found his purpose in the mountains of northern China. Bethune attacked the medical crisis with the same intensity he had brought to Madrid's streets. But this time, His mission went beyond performing surgeries or delivering transfusions. He needed to create an entire medical system for an army that had none, transforming peasants and soldiers into a network of healers capable of providing sophisticated care under primitive conditions. The first challenge was training. The Eighth Route Army had soldiers willing to learn medicine, but lacking even basic education. Many were illiterate peasants who had never seen modern medical equipment. Bethune began teaching fundamental concepts, explaining germ theory and sterile technique to students who had grown up believing disease came from evil spirits and bad air. He demonstrated surgical procedures on wounded soldiers, turning every operation into a teaching moment as Chinese students watched his hands work and asked questions through translators. Bethune wrote medical textbooks in Chinese, working with translators to create illustrated manuals that explained surgical techniques, wound care, and disease prevention. These books became the foundation for medical training throughout communist-controlled territory. He simplified complex procedures into step-by-step instructions that could be followed by people with minimal education, breaking down sophisticated Western medicine into practical knowledge that Chinese peasants could master and apply. Field hospitals emerged from Bethune's organizational genius. He established medical facilities in caves and abandoned temples, creating surgical theaters in spaces designed for prayer or shelter. Each hospital had designated areas for different functions: reception, where wounded soldiers were assessed; surgery, where the most serious cases were treated; recovery, where patients healed; and training, where students learned by observing and assisting. The cave hospitals lacked electricity, running water, and proper ventilation, but Bethune designed workflows that maximized efficiency despite these limitations. Sterile technique obsessed him. Bethune understood that infections killed more soldiers than Japanese bullets, and preventing infection required fanatical attention to cleanliness. He taught his Chinese students to boil instruments before every surgery, to wash their hands repeatedly, to clean wounds thoroughly before closing them. He demonstrated these procedures himself countless times, making sterility a ritual that his students absorbed through repetition. The result was a dramatic reduction in post-surgical infections, proving that modern medical principles could function in caves as well as hospitals. Bethune's mobile operating teams brought surgical care directly to combat units, applying lessons learned in Spain to Chinese conditions. Small groups of trained medics traveled with fighting forces, carrying portable surgical equipment and supplies. When battles produced casualties, these teams could perform emergency surgeries in village huts or outdoor tents, stabilizing wounded soldiers before evacuation to field hospitals. The system saved lives by bringing medical intervention to patients within minutes, rather than hours or days. The model hospital at Songyangkou became Bethune's masterpiece, a training center where the best students learned advanced surgical techniques. Here, Bethune performed complex operations while teaching Chinese doctors the fine points of thoracic surgery, abdominal procedures, and wound management. The hospital processed a constant stream of wounded soldiers while simultaneously producing the next generation of army surgeons who would carry Bethune's methods throughout communist territory. Bethune's approach to battlefield medicine defied every conventional safety protocol. While most medical officers established hospitals well behind front lines, Bethune insisted on operating as close to combat as possible. He believed that early surgical intervention saved more lives than safe distances, and he was willing to accept personal danger to prove his conviction. This philosophy earned him legendary status among Chinese soldiers and constant anxiety among military commanders responsible for his safety. His typical position during battles was within hearing distance of gunfire. Bethune would set up operating facilities in village huts or cave entrances just behind fighting positions, sometimes less than a mile from active combat. When wounded soldiers were carried back from the front lines, they found a Canadian surgeon already scrubbed and ready to operate. This proximity meant Bethune could intervene within minutes of injury, stopping hemorrhages and treating shock before they became fatal. The Japanese advance forced frequent retreats, and Bethune perfected the art of mobile surgery. His team could break down an operating theater, load equipment onto mules, move to a new location, and be ready for surgery within hours. They operated in different villages almost weekly, staying ahead of Japanese forces while maintaining medical services for communist units conducting guerrilla warfare. This constant movement would have been exhausting for anyone. Bethune thrived on it, energized by the challenge of maintaining medical standards under increasingly difficult conditions. His stamina became legendary among the Chinese soldiers. Bethune regularly performed 30 or 40 surgeries in a single session when major battles produced waves of casualties. He would operate continuously for 20 hours, his hands steady even as exhaustion made his legs tremble. Between surgeries, he would drink tea laced with sugar for quick energy, then return to the operating table for the next patient. Chinese soldiers marveled at his endurance, wondering how a foreign doctor nearly 50 years old could outwork men half his age. The respect Bethune earned from communist forces transcended his medical skills. He lived exactly as Chinese soldiers lived, sleeping in the same rough quarters, eating the same simple food, marching the same mountain trails. Unlike other foreign advisors who maintained separate living arrangements, Bethune refused special treatment. He learned basic Chinese to communicate directly with patients and students. He wore padded cotton uniforms identical to those worn by peasant soldiers. This shared hardship created bonds of trust and admiration that made Chinese forces fiercely protective of their foreign doctor. Bethune's temper was as legendary as his dedication. He fought constantly with military commanders over medical supplies and equipment, demanding resources that simply didn't exist. When supply lines failed to deliver promised materials, Bethune would rage at logistics officers, his face turning red as he shouted about soldiers dying from preventable complications. His anger came from frustration rather than arrogance, born from watching men die because basic medical supplies couldn't reach the front lines. The outbursts alienated some officers, but earned respect from others who recognized that Bethune's fury came from caring too much rather than too little. By autumn 1939, conditions in northern China had deteriorated beyond anything Bethune had experienced. Japanese forces controlled most major cities and transportation routes, cutting supply lines that brought medical materials to communist forces. The 8th Route Army operated from increasingly isolated mountain bases, dependent on whatever resources could be carried on foot or horseback through Japanese-controlled territory. Bethune's medical operations faced shortages of everything: surgical instruments, antiseptics, anesthetics, bandages, and most critically, surgical gloves. Operating without gloves violated every principle of sterile technique that Bethune had taught his Chinese students. But when glove supplies ran out with no prospect of resupply, he faced an impossible choice: stop performing surgeries or operate barehanded and accept the infection risk. Bethune chose to keep working. His hands, scarred from years of surgery, became the instruments that touched infected wounds, handled contaminated tissue, and sutured incisions closed. He washed thoroughly before and after every procedure. But washing couldn't eliminate all bacterial contamination when working barehanded in primitive conditions. The cut happened during a routine operation in late October 1939. Bethune was removing shrapnel from a soldier's leg when his scalpel slipped, opening a thin wound across his left middle finger. The injury was minor, barely bleeding, the kind of small cut that surgeons experience regularly. In a modern hospital with antibiotics and proper wound care, it would have healed without complications. In a cave hospital in northern China, operating bare-handed on infected wounds with no access to antibiotics, the cut became a death sentence. Within days, the finger became inflamed and painful. Bethune recognized the signs of infection but continued operating, believing his work was too important to interrupt for a minor injury. The infection spread to his hand, then his arm, red streaks moving up toward his elbow as bacteria entered his bloodstream. He developed a fever that grew worse each day, but still Bethune refused to stop working. He performed surgeries while sick, taught classes while feverish, and continued training Chinese doctors, even as blood poisoning slowly killed him. The crude antibiotics available in communist territory proved ineffective against the aggressive infection. Sulfa drugs, the most advanced treatment available, couldn't overcome bacteria that had established themselves in Bethune's bloodstream. His temperature climbed to dangerous levels, his body fighting an infection it couldn't defeat. Chinese doctors who had learned from Bethune now worked desperately to save their teacher, applying every technique he had taught them. Nothing worked. The infection was too advanced, the bacterial load too high, the available treatments too primitive. In his final days, Bethune continued teaching between periods of delirium. He dictated medical instructions to students gathered around his bed, explaining surgical procedures and organizing his medical texts for future use. He wrote letters to friends in Canada and China, reflecting on his work and expressing satisfaction that his medical training program would continue after his death. His concern remained focused outward on the Chinese soldiers who would need medical care, on the students who must carry forward his work, on the mission that mattered more than his survival. Norman Bethune died on the 12th of November, 1939, in the village of Huangshikou in Hebei province. He was 49 years old. The cause of death was septicemia, blood poisoning from an infected cut sustained during surgery. The same hands that had saved thousands of lives had become contaminated while saving one more soldier, and that contamination had killed him. In the end, Bethune's refusal to stop working, despite obvious danger, had fulfilled the destiny his entire life had been building toward. He died exactly as he had lived, operating on the front lines, teaching Chinese students, and giving everything he had to people who needed him most. 3 weeks after Bethune's death, Mao Zedong wrote an essay titled, "In Memory of Norman Bethune," that would transform the Canadian doctor from a historical figure into a revolutionary icon. Mao praised Bethune's internationalism, his selflessness, and his devotion to helping others without regard for personal benefit. The essay held Bethune up as a model for Communist Party members, emphasizing his willingness to sacrifice everything for people he had no obligation to help. Mao wrote, "We must all learn the spirit of absolute selflessness from him." The essay became required reading for millions of Chinese during the Cultural Revolution. School children memorized passages praising Bethune's dedication. Workers studied his example during political education sessions. Soldiers were told to emulate his courage and commitment. The Communist Party used Bethune's story to encourage selfless service to collective goals, making the Canadian doctor's memory serve political purposes he might not have endorsed. His image appeared on posters in textbooks and in propaganda films that celebrated his sacrifice while simplifying his complex character. Hospitals, medical schools, and monuments bearing Bethune's name spread across China. The model hospital he established became a pilgrimage site where medical students learned about his innovations in battlefield surgery. Statues depicted him performing operations or teaching Chinese students, frozen in heroic poses that emphasized his foreignness and his dedication. The Bethune International Peace Hospital in Hebei province became one of China's premier medical facilities, training generations of doctors in techniques their foreign teacher had pioneered. The cult of personality that developed around Bethune's memory created tensions between historical reality and political mythology. The real Bethune had been a complicated man, brilliant but temperamental, dedicated but sometimes arrogant, genuinely committed to helping the poor, but also attracted to the drama and danger of war zones. The mythologized Bethune became a flawless revolutionary saint, all virtue and no flaws, serving propaganda purposes rather than historical truth. His memory was exploited to encourage conformity and sacrifice in ways that oversimplified his actual motivations and character. In Canada, Bethune's story remained largely unknown for decades. His communist politics made him controversial during the Cold War, when association with communism could destroy careers and reputations. Canadian medical schools that should have celebrated his innovations in mobile battlefield medicine ignored him instead. Uncomfortable with his political radicalism, The government that should have honored a Canadian who saved thousands of lives preferred to forget him rather than acknowledge his communist sympathies. The rediscovery of Bethune in Canada began in the 1970s as relations between China and Western countries normalized. Canadian officials realized that millions of Chinese revered a Canadian doctor, whose name was barely recognized in his home country. Bethune became useful for diplomatic purposes, a connection between Canada and China that transcended political differences. The government that had ignored him for decades suddenly claimed him as a national hero, establishing historic sites and educational programs celebrating his achievements. His complicated legacy resists simple interpretation. Bethune was genuinely heroic, a medical innovator who pioneered mobile battlefield medicine and saved thousands of lives through dedication that ultimately killed him. He was also used by political systems to promote ideologies and encourage behaviors that had nothing to do with his actual beliefs or intentions. His memory serves simultaneously as inspiration and warning, demonstrating both the power of individual dedication and the ease with which heroic stories can be manipulated for purposes their subjects never intended. Norman Bethune's mobile blood transfusion units became standard equipment in modern warfare. During World War II, military medical services worldwide adopted variations of his innovation, bringing blood products to wounded soldiers rather than waiting for evacuation to distant hospitals. The technique saved countless lives in European and Pacific theaters, proving Bethune's concept on a global scale. Combat medicine in Korea, Vietnam, Iraq, and Afghanistan continued using mobile medical units descended directly from his Spanish Civil War innovation. The medical training systems Bethune established in China influenced healthcare development for generations. His emphasis on teaching peasants and soldiers to provide sophisticated medical care demonstrated that effective healthcare didn't require elite education or expensive facilities. The Barefoot Doctor program that brought basic medical services to rural China after 1949 built on foundations Bethune had laid, training community health workers using principles he had pioneered. The thousands of doctors and medics Bethune personally trained carried his methods throughout China and beyond. His students became teachers themselves, passing techniques and principles to new generations of healthcare providers. The ripple effects multiplied exponentially as each person he taught went on to treat thousands of patients and train dozens more medical workers. Bethune's life poses a question that transcends medicine. What does it mean to truly serve humanity? He chased wars across 3 continents, operated until infection killed him, and gave everything for strangers who would never know his name. His story doesn't provide comfortable answers about the limits of dedication or the wisdom of total sacrifice. Instead, it stands as testament to what one person can achieve when conviction overcomes caution, when mission matters more than survival. The doctor who chased the front lines left behind more than medical innovations. He left a challenge to everyone who believes that helping others requires staying safe, that making a difference demands self-preservation. Norman Bethune proved otherwise, and the blood he shed on that operating table in northern China continues flowing through the veins of mobile battlefield medicine worldwide.